I'm Dr. Cassie from NAVC's Vetfolio and the host of Vet2Vet. Osteoarthritis is a common cause of canine lameness, but we can't overlook soft tissue injuries. Adding something like regenerative therapy and more specifically platelet-rich plasma to our multimodal pain management toolkit gives us one more promising way to reduce pain and increase quality of life for our patients. I'm joined today by Dr. Michael Jaffe from Mississippi State College of Veterinary Medicine. He's a diplomate of the American College of Veterinary Surgeons and a certified canine rehabilitation practitioner. Dr. Jaffe, thank you so much for joining me. I'm really excited to talk to you. This is such an interesting topic.
Yes, thank you for having me.
Yeah, so thrilled that you're here. And let's go ahead and dive right in and talk about regenerative medicine. So
Right.
when we say regenerative medicine, what are we referring to? And maybe actually more importantly, what are we not referring to?
Yeah. So, when we talk about regenerative therapy, we're really talking about treating patients with stem cell therapy, platelet-rich plasma. We're really talking about using their own natural cells to treat problems that they have, orthopedic problems in today's case that we're referring to. And it's a bit of a misnomer when we say regenerative therapy in the sense that we're not actually regenerating tissue that's been lost, but we are reducing inflammation and we're trying to improve the body's ability to grow and heal itself.
And when you say grow and heal itself, because I hear what you're saying that we're not replacing tissue that's been lost. Are we, if we're talking about cartilage or blood vessels and things like that, are any of those kind of coming back in this process? And maybe we're forming these new, so we're not necessarily regenerating, but kind of opening this pathway to form new tissue, or is it primarily aimed at reducing inflammation?
Yeah, it really is aimed at reducing inflammation in this tissue. So once the cartilage is damaged, we're not really able to grow new cartilage, but we can at least reduce some of the inflammatory changes that are associated with arthritis, because when there is arthritis and when it's chronic, unfortunately, it does cause damage and breakdown of the cartilage. So we're trying to at least slow down that damage and in some cases stop it altogether. And when there's that damage associated with problems such as osteoarthritis, there's a tremendous amount of inflammation in these joints. And that produces a lot of discomfort, pain, swelling, heat, redness for these patients. And when we're using multimodal therapy in all forms, including regenerative therapy, our goal is to try to reduce that pain, reduce that swelling, reduce that inflammation, and basically make our pets more comfortable.
That makes a lot of sense. So we're gonna, like you said, with all of our therapies here, we're targeting reducing the inflammation, reducing the pain, making our patients more comfortable. And if I heard you correctly, you said the inflammation is responsible for a lot of that tissue damage. So hopefully we get this happy effect in the process of slowing or ideally stopping some of that tissue degeneration. Did I interpret that correctly?
Yeah, you sure did. It's, again, with inflammation, inflammation is something that is chronic and it just kind of keeps coming back and going away and then coming back. And with chronic osteoarthritis in our pets, we know it is not something that we're going to cure and it's not something we're going to completely take away, but we can manage. And that's what the goal of multimodal management is to try to reduce some of that chronic long-term changes that are painful. And again, we're not going to take it away completely, but we want to try to diminish it to the point where at least our pets can enjoy their quality of life and do the things that they like doing, and owners can at least see their pets and hopefully see them feeling, a little bit more comfortable back before they had their arthritic problems that developed.
Absolutely, really aiming at that improvement in quality of life. And I have to tell you, when I think about words like regenerative medicine and platelet-rich plasma, I start to think of, okay, referral and, are we talking rehab versus surgery or integrative care or something like that? Is there a place for regenerative medicine in general practice?
Yeah, there absolutely is. It's really not as hard to do regenerative therapy as people actually think it is. With stem cell therapy, if you can tap a joint, then you can do stem cell therapy on an arthritic joint. because when we tap a joint, we're pulling some synovial fluid out. But with regenerative therapy, we're actually injecting stem cells into this inflamed joint. So it's not terribly difficult. Now, with PRP, there may be a little bit more of a challenge in some cases because PRP really involves just drawing blood from our patient and filtering down so that we have a high concentration of their own platelets. And then we're going to use those platelets and we're going to inject those platelets into tissue where there may have been damage or inflammation. Now, the challenge with PRP is that when we're treating something such as a muscle or a tendon disorder, we typically will do that using ultrasound guidance. And the ultrasound will at least guide our needle so that when we're injecting the PRP, we're injecting it in the right place. Doing it blindly, it certainly is something that can be done, but it's much, much easier to at least guide that PRP and put it in the tendon of interest where there is damage. Now, when we use PRP for intra-articular use, again, just like stem cell therapy, if you can tap a joint, then you can do PRP and stem cell injections in these arthritic inflamed joints. So there's really not a tremendous amount of technical skills beyond what we normally do every day.
Sure. And I think you might be selling yourself short a little bit there. I mean, guiding my needle into, the correct area in the muscle or tendon does sound like it certainly requires some level of skill.
Yeah.
But to your point, when I'm thinking about tapping a joint, that also requires some level of knowledge. But, thinking about a stifle where we see osteoarthritis so commonly in our canine patients, I think that is certainly one that I would feel comfortable, putting a needle into. And while admittedly, I don't tap a whole lot of joints on a regular basis, my experience with it is it's something that can be fairly, I don't want to say easily, but it can absolutely be learned and taught, and not an incredibly difficult technical technique.
Yeah. Yeah. Some joints are more amenable and easier to, do arthrocentesis or tap the joints and subsequently inject stem cells. Certainly stifles, the tarsus, the carpus, those are much, much easier because the amount of tissue surrounding the joint is minimal. It's easy to palpate those joints. And certainly if there's a fusion, it's easy to feel those. Now, granted, joints such as shoulders and hips, they're technically a little bit more challenging, especially in big dogs. Elbows aren't too difficult, depending on the disease, though. But like you said, given the fact that stifle osteoarthritis is so prevalent and it's one of the most common joints that we see arthritis in, I think it's probably something that has a very short learning curve. Certainly is something that can be done. Of course, we do it under sedation with a minimal number of attempts at passing a needle into the joint. It is very rewarding once you're able to get in there and do these things. Most textbooks do offer at least diagrams or information as far as the landmarks that you'll palpate to do these techniques. And many people may have learned these techniques at some point along their career as well. So again, it's something that I feel that is fairly easily done by many people in practice.
Well, that's wonderful news, especially giving us some of these options. I mean, there's just nothing worse than having an arthritic dog who, is with it mentally and otherwise healthy, who's struggling to get control of that pain and give them their quality of life back. Now, thinking about sourcing the platelet-rich plasma, I'd like to talk about tools because I think this is more complicated than maybe complicated is not the right word. Because I think there's a little more to it than, just spinning down some blood in our routine centrifuge that we use. So I'd like to talk a little bit about the ProVet. Can you tell us how you use that device to treat musculoskeletal disorders?
Yeah, it's a wonderful tool. We've been using the ProVet from Decra for about the last year or so, and it really is so much easier than the technique that we used to use using just a regular centrifuge, where it took many different steps. With the ProVet, from the time that we draw blood to the time that we have our PRP is a minute and a half. And my technicians absolutely love it because we can do it cage side. We can harvest the blood. We can process it at the time that we're doing an ultrasound, say on a tendon, or have a patient under sedation for evaluation of their joint. So again, it does involve drawing some blood and then adding the blood to the ProVet. Literally, there's one button that we push, and after about a minute and a half, we aspirate the PRP back. Now, as far as what is PRP, it is, as the name implies, platelet-rich plasma. It is plasma that has a very, very high concentration of platelets. And the nice thing about these platelets is that, when we were all going to school initially, we thought that we learned that platelets are there so that when we have a cut, platelets stop the bleeding, and that's what platelets do, and that's all they do. And well, over the years, we've subsequently learned that platelets do so much more. In fact, platelets carry cytokines and growth factors that are extremely important in helping tissue heal and helping tissue reduce inflammation. And so that's the idea behind using platelet-rich plasma. So like I said, we draw blood, minute and a half later of processing with the ProVet centrifuge, and we have our PRP. It's that easy. Now, with stem cell therapy, it's a little bit more involved in the sense that it does require a minor surgical procedure. And that procedure is simply a skin incision where we harvest some subcutaneous adipose tissue, because that's where most stem cells is in subcutaneous fat. And so it is a little bit more of an involved technique. We do have to do general anesthesia for that because it is a surgical incision. And the processing is done externally where we send it out. We work with companies that process stem cells for us. So it's a little bit more involved, but PRP couldn't be easier.
It sounds like it. It sounds like it. I know I certainly feel empowered and I'm going, okay, all right, this makes sense. This seems like something I can do. And along the lines of our earlier discussion about how, there's a relatively short learning curve, at least when it comes to some of these joints, and fortunately, some of the more common joints, since it's not something that we do commonly in general practice, what sort of skills more specifically? I mean, certainly it sounds like tapping joints, but can you recommend specific skills that we should practice or, techniques we should be familiar with in order to really feel comfortable implementing this therapy?
Yeah. Yeah. So, anytime we're doing a joint aspirate or whether we're doing a PRP or stem cell injection, obviously we're going to use sterile techniques. So it involves shaving the joint, doing a sterile prep, using sterile gloves, and basically everything is handled in a sterile manner. Now, if you're unfamiliar with the landmarks for these joints, like I said, there are a number of textbooks that do offer guidance in terms of pictures or descriptions of what to palpate for these joints. One of the things that I always do when I'm aspirating a joint is I have the radiographs of that joint in front of me. So I can use that to help me palpate the landmarks and identify where I'm doing my aspirates or where I'm doing my injections. And again, it's one of those things where you just have to kind of dive in and just do it kind of thing. And it's really not as hard as people seem to think. So again, it's probably one of those things where somebody may feel a little bit intimidated about doing it, and then afterwards they may look back and say, "Well, gee, that wasn't as bad as I thought it was." Because again, it is something that yes, I do on a daily basis, but I think that people who are not doing it on as regular a basis, once they gather that skill, then it is something that they do kind of have. It's kind of like, we get so used to our technicians putting IV catheters in that oftentimes we as doctors don't put IV catheters in very often, but when we're asked to, we're able to just go ahead and do it. And I think that's the same with doing fine needle aspirates from joints or doing joint injections. It's something, it's the old riding a bike skill that it's always there. You just have to pull it out when you need it. So again, it's one of those things where I encourage people, if you have any reservations or hesitations about doing it, to at least give it a try. And you might be surprised it's easier than you think.
I think that is the perfect analogy about the IV catheter because you're right. I do really get used to technicians because they're so good at it placing these IV catheters. But every now and again, like you said, we get thrown into the mix and somehow that skill is still there. And I feel that, thinking about my very limited experience tapping joints, even though it's not something I do on a regular basis, if you put a dog in front of me right now, I do feel like it's one of those riding a bike skills where I'm going, okay, I could do this. I could muddle my way through this, even if it's something I'm not doing on a daily basis. And when I think the thing that scared me, first getting into tapping joints was, well, what if I do something wrong and I cause damage? And certainly, like you talked about sterile technique and sepsis being a big concern. Are there any other risks we should be worried about? And I guess I'm hoping you say not so much, and that's all the more reason to be comfortable with it.
Yeah, really. Again, when we're talking about tapping joints such as, say, the elbow or the stifle, the tarsus, the carpus, they're very, very easy joints. With the good news is there's nothing scary in the way from where your needle is passing through. You're basically going through skin, maybe a little bit of subcu, a little tiny bit of muscle, joint capsule, and then you're in the joint. And so that's the nice thing about again, looking at the landmarks that are described for these joints is that they have proven safety and minimal problems associated with them because again there's usually not anything big or scary in the way. Like I said, the shoulder and the hip joint are definitely more challenging, and there are times when we struggle with those even though we do them all the time. They can be more challenging to do. So again, if this is something that somebody is wanting to get into and is interested in, certainly the lower extremities I think would be the joints where you probably want to gain your confidence a little bit before you step up to something that may be a little bit more challenging. And there is a lot of safety in tapping anything from the elbow and the stifle on down.
Sure. And I'm glad you brought up the shoulder and the hip. Sometimes I forget about those guys. And yes, I could see those being more technically difficult
They
to
are.
manage. So I think it sounds like what you're saying is, these lower extremities will probably be technically easier and, maybe a little bit less of a struggle. So start there and kind of work our way up.
Yep, yep. And then as far as injecting PRP in some of the muscles, most of the time when we inject muscles, we're injecting muscles, tendons such as the supraspinatus, the biceps muscles, or the iliopsoas or calcanean tendon. And yes, those are really, really challenging to do without ultrasound. Now, I am not a great ultrasonographer, but I'm very fortunate to have wonderful radiologists here at the university. So I am spoiled. I'll say that. For cases where tendons may need injection, it may involve somebody who is very skilled at doing ultrasonography for those types of cases. So again, if there's somebody in your practice who is very comfortable with doing these things, or if it's something that you feel like it is something that you'd like to learn, I encourage it. I think one of the things that I've been finding is that in small animal practice, we don't really ultrasound tendons as often as, say, our equine practitioner friends who ultrasound tendons all the time. And they're really good at it. And it's something that I think that as small animal practitioners, we could be good at as well. We just have to give it a try. So a few years ago, I did start ultrasounding tendons on my own. And I'll be honest with you, I didn't know too much about what I was looking at, but I was shrewd enough to know that if I looked at the shoulder on one side that was not lame, and then I looked at the shoulder on the other side that was lame, and something didn't look the same to me, then I could figure out that maybe there is something. But over time and with practice, I started getting a better feel for what exactly I was looking at, and again, feeling more comfortable being able to inject those tendons. But again, now I'm a little bit spoiled because I've got some great radiologists here.
Well, but I think you make a good point because more and more we're utilizing ultrasound in practice, and this is just another use for it. I'm with you. I'm also not a great ultrasonographer. And so, yes, I would worry a little bit about my ability to find them. But I think that's really good advice of just start looking
Yeah.
and comparing, get an idea of what you're looking at. Some this is going to come more easily to than others. And as you get more comfortable, then it kind of opens the door for more of these techniques.
Yeah, and it's minimally invasive in the sense that, again, whether you're, even if you're not injecting the tendons, at least looking at these areas and getting familiar with what the anatomy is in those areas. And I'll be honest with you, again, I had to look at a lot of textbooks, and I'll even admit that I cheated and found an equine practitioner friend who was very, very good at ultrasounding tendons, and she showed me how to do it a little bit. So I did have a little guidance from a friend in that regard. And again, I think, with anything like that, where we're learning a new skill, leaning on people who have more knowledge than we do in those things is certainly helpful. And it helped me. So again, make use of those skills if you're able to.
I don't think that's cheating at all. If that's cheating, then my entire job here is cheating because that's all I do is ask questions of people who know way more than I do. So I think that was a good idea to, seek that out. And then it ultimately, we do that kind of stuff. And like you said, even if we're not injecting, we're just looking, we're just becoming familiar.
Yeah.
We're elevating our ability to provide care, and then we can help the other people around us. And ultimately it's our patients who win. So I think that is a perfectly acceptable use of cheating.
Yeah. And the nice thing about that was, a lot of times with these, say, muscle and tendon injuries, they don't always show up radiographically, or at least the signs are oftentimes more subtle. And if I'm simply looking with ultrasound, and like I said, it's non-invasive, at least I can give my owners an answer and say, yeah, there is something abnormal about this tendon, or I looked and, maybe it looks exactly the same as the other shoulder, which seems fine, and maybe we need to look at something else. So at least it gives them somewhat of an answer, and then determining what do we do from that point forward. So again, it's harder than it sounds, but after a while, it becomes easier than you think.
Absolutely. Absolutely. Well, as I said before, and I still feel that way, I definitely feel empowered to explore some of these regenerative therapy options and elevate that level of care for patients. And so, Dr. Jaffe, I can't thank you enough for joining me and for all of the amazing information. This has been such a great talk.
Well, thank you for inviting me again. And it's an area that I have a lot of passion for, and it's something that I know that our practitioners see every single day. And our goal is to try to help these patients and help our practitioners grow.
Absolutely. Absolutely. And I think this is such a good example of how to do that. So thank you again.
Thank you.
And thank you to DECRA for partnering with us for this edition of Vet2Vet. Check out NAVC's vetfolio.com for more of our V2V discussions on various topics in veterinary medicine. And remember, if one animal is better off because of you today, it's a great day.